Hi, my beauties. Okay, so the house is quiet. I just got my kids to bed and I have my AirPods in, so hopefully the audio will be a little bit better. And I wanted to do a YouTube video just like I do every week covering a dermatology or skincare topic that I feel like has come up a lot with the questions and DMs that I've gotten from patients and followers. And the most requested topic I think I get is to talk about melasma and hyperpigmentation, because it's a very common thing that we see in dermatology, and I think a lot of people struggle with it, myself included. You know, I have melasma and kind of am challenged with it every day and have to switch up my routine to kind of keep it at bay as well. So I wanted to cover this topic today. So when talking about hyperpigmentation, there's lots of various causes for it. Probably one of the most common causes is melasma, but there's also cellular lentigines, which we refer to as brown spots from sun damage. There could be post-inflammatory hyperpigmentation, for example, from acne scars or other traumatic injury to the skin. There could be chloasma. There could be lots of different hyperpigmentation alterations in the skin due to various causes. And the causes for hyperpigmentation can vary too. It could be hormone levels, it could be stress, it could be trauma, it could be heat, it could be your diet or things going on internally. So there's various causes of hyperpigmentation and melasma, and kind of knowing what is causing it can help modify our behavior or help guide treatments for the hyperpigmentation. So for the most part, I'll probably focus more on melasma, but this is true for most causes of hyperpigmentation in general. But what hyperpigmentation and melasma is from is an overproduction of melanin, which is the pigment in our skin made by the melanocytes, which are the pigment-producing cells in our skin. So the way to treat or control melasma is to slow the melanocytes down that are processing and producing pigment too actively or too much, and also to kind of rid the skin of any residual hyperpigmentation that may be lingering around. So slowing down the melanocyte activity and minimizing the production of melanin is just one part of the process. Even if we achieve that by either skin brighteners or tyrosinase inhibitors, things of that nature, the hyperpigmentation that's already been overproduced is just kind of lingering and hanging around in the skin. So using certain types of chemical exfoliants, chemical peels, or certain topicals to remove that excess pigment is the second part of the treatment. And then there's the third part of the treatment is keeping it gone. So using a good broad-based, mineral-based sunscreen and kind of having different behavior modifications, or using active ingredients in your skincare products, or getting laser treatments to kind of keep it at bay once you achieve your goal of clear skin and you do even out the hyperpigmentation. There's a little bit of work in maintenance too. So I'll broadly go over different types of treatment to target melasma. First and foremost, the easiest way to treat anything is usually by using topical medications or skincare products. There's also lasers, and there's various types of lasers, which I'll get into as well. And then things like chemical peels, and sometimes combining these different treatments together even gives a better response instead of just doing these individual therapies alone. So starting with one of the most common active ingredients known to correct hyperpigmentation is hydroquinone. Hydroquinone is a highly controversial active ingredient. However, if you do your online search, dermatologists usually prescribe it. It has to be a 4% or higher for a dermatologist to prescribe it. There's a lot of 2% hydroquinones that are over the counter and accessible. And I think nowadays you can even go online and FaceTime with a consultant who may or not be a dermatologist, but would be a physician overseeing an online web-based kind of prescription service to get hydroquinone. And sometimes that could be a little scary, because I've even had patients in my clinic who have given as high as a 12% hydroquinone, and they've been using it for a prolonged period of time because they're not really being followed by a dermatologist clinically, but they're getting it online from some online service, and then they suffer from the side effects of long-term use of very high percent of hydroquinone. One of the side effects being ochronosis, where you get a paradoxical darkening of the skin. So just be mindful of that and just be careful, because high percent hydroquinones used for a prolonged period of time can have some deleterious side effects, one of them being ochronosis or paradoxical skin darkening, which is very hard to reverse once it happens. And as a dermatologist, I myself prescribe patients hydroquinone, but I prefer a 4% hydroquinone. Anything less than 4% is not going to be strong enough, and you're just subjecting your skin to the side effects of a hydroquinone without the benefit of the hydroquinone itself. So usually I prescribe a 4% hydroquinone, a smart hydroquinone that's engineered and technologically advanced to where it's going to pack a bigger punch at a lower percent than it is at like giving a 12% that's not engineered that elegantly. So I think, long-term use is just very variable depending on the patient. If you look online, you may see 3 to 6 months. Some doctors will prescribe it for a year. It just depends on how the patient's using it. Are they using it twice a day, once a week, 1 week off, 1 week on? There's various ways to do it. So don't get hung up on the duration because each individual patient is different, and the schedule in which you're using the hydroquinone may vary too. So it's important to keep that in mind, but I always try to taper my patients off of hydroquinone once they've achieved a great response, and then switch them over to a non-hydroquinone skin brightener, which may be a little safer long term. So other skin brightening agents that can be used topically include cystiamine. So this is one that's gotten a lot of attention in, I think, in the media and just in dermatology in different forums and online and social media. So cystiamine is an antioxidant. It's a tyrosinase inhibitor. Tyrosinase is the enzyme that's used to convert melanin to make the pigment. So it's a non-hydroquinone skin brightener that works via that mechanism. The problem with it is sometimes patients don't have a great response to it. It's very hit or miss. Some people may clear on it after being on it for 2 months or so. Usually that's the average duration that a patient would have to use the cystiamine to notice the results and get an improvement. But sometimes patients just don't respond at all, and it could be a little bit irritating on the skin. Usually you put it on for about 15 minutes and then you wash it off. So I don't usually prescribe it because in my office we usually achieve great results just using non-hydroquinone skin brighteners. Hydroquinone, when we need it, just pulls for a short amount of time and combining it with laser therapy. But I have colleagues that do prescribe cystiamine and have had plus and minus responses for their patients. So it's very variable. Another medication that comes up with melasma a lot is tranexamic acid. So this has gotten a lot of attention recently, and patients often question, about this medication. It is a systemic oral medication. I, as a dermatologist, don't usually prescribe this to my patients, again, because I get pretty good results using topicals and lasers. However, I do have colleagues that do prescribe tranexamic acid. It does carry a side effect that could be dangerous, hypercoagulable state, or the risk of clots and blood clots. So, it's always important to weigh out the risk-benefit ratio of medications. And, in my practice, I don't think that the risk of, systemic effects, nausea, vomiting, anaphylaxis, blood clots, things like that are worth risking for your skin, although I'm skin's one of my top priorities when it comes to your health and overall side effect profile of a systemic medication. I don't think tranexamic acid, is worth it. I do have colleagues though who do prescribe it for short amounts of time, and they're very controlled when they do it, and they do it very carefully, and they've had great success. So that is an option for some people for melasma, but it's not usually at the top of my list for standard of care for treating melasma. But that's just to say I wanted to be all inclusive and include all treatments that are out there for melasma, and that's one of the stronger ones with a more hefty side effect profile that I personally as a dermatologist would want to avoid, and I think most of my patients would too. So then getting to the non-hydroquinone topical skin brighteners, there's vitamin C, there's azelaic acid, there's kojic acid, there's ferulic acid. There's lots of non-hydroquinone skin brighteners out there that work really well, and some of them are medical grade. There's Vitera 2.0 by SkinMedica, there's Eventone by Skin Better Science, and sometimes I feel like this is a safer way to achieve results with melasma. Now, sometimes when a patient hasn't used any treatment and the melasma is very severe and you need to get them from point A to point B with improvement, it may take a little bit more aggressive treatment with lasers or with a hydroquinone for a short period of time or so forth. And then once the patient has gotten the results that he or she wants, it's just maintenance at that point, and that's when all these other non-hydroquinone skin brighteners come into play. Oftentimes, though, that's all a patient will need is just do combinations of these non-hydroquinone skin brighteners, azelaic acid mixed with vitamin C, mixed with some kojic acid and things of that nature to kind of slow down the melanocytic activity and melanin production skin, and then something like a chemical exfoliant like a glycolic acid or like a 3-step peel to kind of rid all of the pigment that has been lingering around from the previous overactive melanocytes. So I think each individual patient is different, and when I see my patients in my office, I'll ask, what treatments have you had, what has worked, what has not worked, and sometimes something that will work for his or her friend may not work for them. So it's important to keep that in mind too, because every skin type is different. Every skin type may have a different risk for hyperpigmentation, and even looking at the melasma may be variable not only from patient to patient, but even within the same patient. Like the hyperpigmentation above the lip may be mid, superficial, and deep, and then the hyperpigmentation along the cheeks is just superficial. So when you look at the skin under the microscope, it can be superficial, mid, deep, or it could be all three. So sometimes when certain areas will fade faster than others, or you'll have that like hard to treat spot that just won't go away even when you can clear the rest of your skin, it's usually because it's a deeper component of the melasma and the pigment. So I'm a laser surgeon as well, so I have to talk about lasers, of course. And it is true, I'm going to preface this by saying that some lasers can induce hyperpigmentation, and so you want to stay away from those lasers, or if you do use those lasers, use them safely and have the appropriate education and background to know what settings to use, how to pre and post condition the skin so that hyperpigmentation doesn't occur. Because the last thing you want is that the melasma is treated, the patient's very happy, and then 2 weeks later they hyperpigment from the laser that was used to treat the pigmentation. So you don't want to get into that situation. So lasers that are known to be safe for melasma include the pico laser and clear and brilliant. So, and they are safe for darker skin types and treatment of melasma because of 2 different mechanisms. So clear and brilliant is a very superficial laser. It was actually engineered to treat types 3, 4, and 5 skin, which is darker skin tones with melasma. So it's engineered for that. So it's very safe to treat hyperpigmentation in darker skin tones and skin of any color for that matter. And usually because it's a more superficial and gentle treatment, it requires more frequent treatment. So instead of one aggressive laser treatment, it's kind of like 5 little baby laser treatments. But patients often do really well with this, and I think it eases them into it, and it's no pain or downtime, and it chips away at the melasma very effectively in a very tolerable manner. Now, another laser that's really great for melasma and safe in darker skin tones as well is the pico laser. So there's PicoSure, there's PicoWay, there's different pico lasers that are engineered by different laser companies, but the reason why it's called pico is because it's a really fast laser. I always call this the Lamborghini of all lasers because it's the fastest. A picosecond is a trillionth of a second, and what happens is when the laser fires and breaks up the melanin for immune cells to kind of come in and take it away, it does it so fast that there's a photoacoustic, not a photothermal reaction. And what that means is it just shatters the pigment based on the pulse within the amount of energy being put into that pigment, and there's no dissipation of heat, which means that there's no hyperpigmentation. Whenever there's a dissipation of heat, your melanocytes get revved up and they make more melanin. So it's because the laser is so fast that there's no thermal dissipation, there's no heat, it just destroys it on site, and then your immune system comes and clears it away. So it's actually one of my favorite lasers for treating really stubborn brown spots, or those really tough melasma spots, or melasma that's not responding to lighter lasers as well. And usually it's a one and done treatment. Unlike clear and brilliant where it's more superficial and gentle, this one's just like a take care of business, and there is downtime of about 1 week of the pigment kind of coming to the surface, so it gets darker, and then once it peels off, it's just like bright, fresh baby skin underneath without pigment there. And then it takes some time for it to even out with the rest of the skin, because then the skin that wasn't treated with the laser can actually appear darker than the dark spot that was treated with the laser. And another laser that I wanted that's worth mentioning is V-beam. So V-beam is working by a totally different mechanism for melasma. So if you look at melasma under the microscope, there's usually an increased vascular network or blood supply to the melasma plaque skin. So those melanocytes are overproducing melanin most of the time because they're getting a rich blood supply that's supplying them with nutrients and revving them up and making them more productive. So if you target V-beam, which is a vascular laser that treats blood vessels, sometimes it really works well for melasma treatment. Usually it's not the first line of therapy, so usually I wouldn't see a patient in clinic and be like, okay, we're going to do V-beam for your melasma. Usually we'll try like a clear and brilliant or a pico or just a chemical peel or topicals alone. But if it's kind of stubborn, and when you blanch it, when you kind of like press your finger with it, if it gets blanched, it goes from kind of like a reddish brownish to like just a brown, and then it fills back up with, the blood supply, refills and causes kind of like a reddish brownish patch. Usually that's the type of melasma that would respond well to V-beam. And then lasers to avoid. So some lasers can make hyperpigmentation worse, especially in Asian skin and darker skin tones. One of them being Fraxel. Now, I'm a Fraxel surgeon. I love Fraxel. I use Fraxel all day long for anti-aging, fine lines, wrinkles, acne scars, shrinking pores. It's an amazing laser, but it can hyperpigment. So it's not my first choice when it comes to treating melasma. Although, sometimes if patients aren't responding to other laser therapies, I will have to pull it out of my armamentarium and treat with Fraxel, but I use very light settings. I adjust the settings based on endpoints with each individual patient, and I usually will pre and post condition the skin with some hydroquinone or a non-hydroquinone skin brightener to stabilize the melanocytes. So I get the melanocytes kind of like calmed down before I blast them with the laser, and then they don't respond with making a lot of melanin. Usually that's not my first choice of doing things, but this is what we learned how to do in laser fellowship, and it was a great learning point. I remember when I was in fellowship, because sometimes we'd have darker skin types that would have acne scars, and Fraxel is one of the only things that can really, really help acne scars. So my attending would say, we're going to treat the acne scars and get the topography and the texture of the acne scars better. We're going to end up hyperpigmenting the patient because of the laser, but then we're going to do a different laser to treat the hyperpigmentation. So hopefully that's not usually the cause, the situation, but if it is, being in the hands of a skilled laser surgeon, it can be done safely and effectively with a good plan and a good protocol to follow. So I hope this helps, talking about various treatments and causes of hyperpigmentation and melasma, and not to get discouraged. It does sometimes take work, and then once you have your melasma cleared, or you're where you want to be with your pigmentation, if it's all nice and clear, or if it's you'll go back to where you were, especially if you're on hormone replacement, or you're on the birth control pill, or you get pregnant, or you're breastfeeding, or you do hot yoga every day. There's certain things that we can't change, and to keep the melasma gone, one of the best things to do is to use a good mineral-based sunscreen, because ultraviolet light can rev up your melanocytes to cause overproduction of melanin. And then another thing that I also recommend for my patients is HelioCare. HelioCare is a natural plant-based enzyme that helps protect the skin, the DNA in the skin, from ultraviolet light radiation. It also is really great for melasma, and it's used in other areas of medicine too, in neurology to prevent like Alzheimer's disease, and my immunology colleagues use it to boost the immune system. So it has a lot of other health benefits, and again, it's vegan, it's plant-based, and it's an antioxidant that you can take every day, once a day. Put it in your smoothie, take it with your breakfast. And if you're being treated for melasma, I recommend it because it's kind of like an internal protection mechanism, in addition to other things that will help prevent melasma or hyperpigmentation from getting too out of control. So I hope this video helps. If you have any comments or questions, I'd be happy to answer them. Usually right after posting, I'm pretty responsive to my comments, but please keep in mind that I'm usually in the clinic seeing patients and doing treatments, and I will eventually get back to all you guys, but it may not be like that day or the next day, because once the work week starts, I'm treating my beauties and my patients in the clinic. But I'll always get back to my YouTube family and all your questions and concerns and very thoughtful comments. All right, thank you. Hope this helps.